Okay, thank you everyone for joining us. As you know, since last Friday, the number of known COVID-19 cases in Pennsylvania has grown from 2 to 22. And we have another 219 people under investigation. We've watched as other states, we've watched as other countries have struggled to control this coronavirus. And we've learned a lot from their efforts. So beginning tomorrow, Friday, March 13th, we're going to begin significant and decisive social distancing. This plan is statewide, but because Montgomery County has seen a rapid growth in the number of cases, residents and workers in Montgomery County are going to have special provisions. In Montgomery County, I am ordering the closure of all schools, community centers, gyms, and entertainment venues. This includes Y's, theaters, sporting events, concerts, and I am strongly recommending the closure of non-essential retail facilities. It includes schools of all types, such as pre-K, higher education, and private schools. No mass gatherings should be held, including conferences and rallies. By closing these facilities, we can control the spread of the disease. That's the hope. And we can redirect our public safety and health officials to where they're needed the most. The health and safety of all Pennsylvanians, that's my primary concern. And that's why I'm ordering all critical infrastructure to remain open. This includes all healthcare facilities, such as pharmacies, urgent care facilities, primary care facilities, outpatient services, long-term care facilities, and of course, hospitals. It also includes gas stations. It includes grocery stores. It includes government, utility, public safety, and correctional facilities. And it includes mass transit. My administration is working closely with our transportation partners to ensure that we maintain essential transportation services where possible. Amtrak will begin operating a reduced schedule tomorrow, and the Ardmore station is going to be closed for 2 weeks. That starts tomorrow. We're also working directly with SEPTA to evaluate the potential impact of all of this on mass transit, and we're going to continue to provide service updates as they occur. Any state employee traveling in and out of Montgomery County between their workplace and home are being directed to work remotely. We will continue to offer essential government services. So that's what we're doing in Montgomery County. Across the state, I'm doing 3 things here. I'm strongly encouraging all large gatherings, especially those with more than 250 attendees, to be either canceled or postponed. Second, I'm discouraging people from going to recreational activities in public places like gyms, movie theaters, and stores. And third, I'm asking religious leaders to use their discretion to prevent the spread of illness through their congregations and their communities. These actions may seem severe, but they're far less draconian than what we may have to do in the future if we don't act now. We will begin putting this plan into effect for 14 days, for 2 weeks from tomorrow. And we will continuously evaluate it and make changes that ensure the health and welfare of all Pennsylvanians. We all need to work together to halt the spread of the COVID-19 virus. So, I'm urging all of my fellow Pennsylvanians, do your part. Wash your hands for at least 20 seconds with soap and warm water. That's the amount of time it takes to sing Happy Birthday twice. Cover your coughs and sneezes with your elbow or with tissue. Wipe down all frequently touched surfaces. Avoid sick people. Stay home if you're not well. Maintain at least a 6-foot distance from other people. And please follow the directions I've given to stay out of public places. Nobody wants to be the person who shares this virus with their office or with a member of their family. So please stay home from work, stay away from family gatherings, and stay out of public areas, especially if you're not well. A full list of symptoms as well as other information, you can get that by clicking the banner at the top of pa.gov. And if you feel unwell and you think you may have been exposed to COVID-19, you can seek help by calling 1-877-PA-HEALTH. That's 1-877-PA-HEALTH. While individuals are playing an essential role in preventing the spread of COVID-19, the Commonwealth is continuing to do everything in its power to slow the rate of infection and prepare for an outbreak. We're constantly updating the COVID-19 information page, which, as I said before, is accessible by clicking the banner at the top of pa.gov.
Thank you for attending our latest update on the 2019 novel coronavirus called COVID-19. As of this afternoon, we have 22 Pennsylvanians who have tested positive for COVID-19. And as I mentioned yesterday, we have one individual in the hospital that is a resident of another state, so it gets counted towards that state. In addition to the cases we released in the morning update, we have one additional adult from Pike County who has tested presumptively positive for COVID-19 and is currently in isolation at home. To date, there have been 219 Pennsylvanians that have been identified for testing. 116 of those have tested negative. 20 of those have been tested presumptive positive. 2 of these tests have been confirmed by the CDC. We have that one resident from another state, and we have currently 81 tests that are pending. As the governor had mentioned, but I want to emphasize again, there are steps that everyone can take to keep themselves healthy and prevent the spread of the highly contagious disease, COVID-19. Wash your hands with soap and water for at least 20 seconds, many times a day, 10, 20 times a day. When washing your hands is not available, please use alcohol-based hand sanitizer. Cover any coughs or sneezes with your elbow, not with your hands. Try not to touch your face. Clean surfaces frequently. And if you are sick, please stay home until you are better. Practicing these everyday prevention measures can help slow the spread of this virus. For the most reliable information related to Pennsylvania's response, you can visit our website as well, health.pa.gov. Now, this is a rapidly evolving and changing situation, and as it continues to evolve, we will continue to update Pennsylvanians and all of you through our website, our Facebook, and our Twitter account. If you have questions about your health, please contact your healthcare provider, and we have been working to update providers on how to assess patients and how to obtain information about testing. We work very closely with the Hospital Association, which is actually present at our command center. I have spoken with PA Med last week, and we'd be glad to speak with any healthcare provider. Just call us at 1-877-PA-HEALTH. What is most important is for Pennsylvanians to remember to please stay calm. We have the networks in place to ensure that we will continue to make Pennsylvania a healthy Pennsylvania for all.